So welcome to this presentation, this Module 3C presentation, where we'll discuss briefly on family and diversity. Now, by way of introduction, family play an important part in most people's life. And for most people, the definition of family is quite a personalized one. It varies from person to person. And there are many different kinds of family that you will come to encounter in your caregiving line of profession. There's the nuclear family that consists of a father, a mother, and at least one child. About half of all families that you encounter will be nuclear families. And there's a single parent family that consists of one parent and one or more child. Now, approximately 27% of households are made of single parent families. That could be single motherhood family, that could be single father family. And there's also another entity of same-sex parent families that for caregivers who are coming from the African culture, it may be a shock. You need to be in the know as to such possibilities. It's the onus is now on you to know if you can work in such an environment or not, but it's a possible kind of family you may find out there. And usually couples are of the same sex with one or more children. And approximately 2 million children in the US have same-sex parents. Now, there's the unmarried couples that may be of the same sex or opposite sex, with or without children. So your patient you will care for may fall in this category, or their own children may fall in this category, because eventually when you care for an individual, you end up caring for, coming in contact with the whole family. About 1.5 million children in the US have parents who have never been married. So that could be your patient or could be your patient's child that you care for. Now, couples without children is also another type of family. This is a couple who is married but they do not have children. Such couples may or may not live together, but they consider their unit to be part of what makes them a family. Extended family would include parents, children, grandparents, aunts, uncles, cousins, other relatives, even friends may be considered as part of somebody's extended family. So if your patient says this is an extended family, you know that individual described as an extended family will fall into any of these brackets that we've itemized, and you would want to treat them as your patient desires them be treated. Blended families. Now, divorced or widowed parents who have remarried and have children from previous relationships may have children from the current marriages as well. So about 20% of children in the US live in blended families. So these are also some tricky dynamics that you need to be able to navigate as a caregiver. Grandparents as parents. One or more grandparents can serve as the child of or the children's parents. Approximately 1.3 million children in the US have grandparents who serve as their parents. So even the elderly that you're caring for as a caregiver may be a direct parent to a child who is much, much, much younger than their biological child, because that is their own grandchild. So you also need to be in the know that since they serve as the parent to that child, you will carry that child along as the child, not as the grandchild. Then adoptive or foster families. Families where adoptive or foster children live is called an adoptive or foster family. And about 120,000 children are adopted each year. About 6.3 children out of 1,000 would live in foster homes. So what makes up a family? A family may be different than that of the home health aide. So the family may be different from yours. And chances are, if you work hard and long enough and in varieties of settings long enough, chances are you would meet a lot of families that are starkly different from yours. So who the patient considered to be the family may not be those you would ordinarily identify as family. Some people don't have any living family, or their families live very far away. So they may choose friends, they may choose acquaintances, they may choose uncles, cousins, some distance relations as families. such decisions are made by the patient, it is for you to go along with them, bearing in mind that these families have probably been in your patient's life long, long before you came along. And your patients may also rely on neighbors and friends to help them out. And they may also consider these people as part of their family. So whatever kind of family that your patient has, it is important to recognize the important role that such an individual plays in your patient's life. So any decision within a family may help your patient to make important healthcare decisions, which could include providing daily care. Maybe that the person drives your patient to appointments. Maybe that the person has been helping to contact healthcare team on behalf of the patient. Or could even be that the person has been providing emotional support. So you cannot underrate the place of anybody your patient calls a family. So remember, please, at the core of it is family is who your patient says the person is. So how do you support family members? Family members would oftentimes need to adjust to a patient's illness or disability that comes from maybe accidents or aging. And they may have trouble accepting the consequences of the illness or disability. Family members have many kinds of reaction to a loved one being sick. They may be afraid, they may be sad, they may be angry or frustrated. And there are numerous reasons for this. They may be concerned about finances, how to pay for their family members' medical expenses and medicine. That's the first. They may also be dealing with the patient not being able to work due to their illness and disability, and they're concerned with how they're going to meet the family expenses, which just sounds to reason. And they may be confused with the large amount of paperwork that needs to be filled out and trying to understand medical information that is related to their loved one. So you need to be patient, understanding, and considerate in supporting family members. The family members may also be physically tired from providing daily care for the patient or from frequently traveling to and from the patient's home to care or to visit them. So as the caregiver, please understand with the patient's family. And they may also be afraid that their loved one will never become well or worse, die. So as a caregiver, you play an important role in caring for the patient and your patient's family. So it's important that you're sensitive to the adjustments that this patient's family must make. And you must perform your job well and refer any issue that you cannot competently handle to your supervisor. Empathize with family members. And this means you try and understand how they feel. If a family member comes to you with a problem, listen to their concerns. You really may not be able to fix it, but the fact that they have someone to talk to would make most people feel better about the situation. Now, be supportive and encouraging. Try not to use cliche phrases such as, oh, it will not work out well. Don't worry about it. It's not a big deal. It just undermines the person's concern. And it's important when you listen, you learn to paraphrase just to be sure, so that the individual feels like you're going along with them, and it's a wonderful psychological boost. So if a family member or patient says, I'm scared or I'm stressed out, as a caregiver, you can use reflection to let them know that you've heard them and you understand how they feel. So phrases like, you're feeling scared. I can imagine how stressful this must be for you. Or you're feeling anxious about what happened to Mr. James. Let the person know that you're really listening to them, not just, okay, just those monologues that doesn't really carry much weight. So if the problem that the relative is bringing to you is out of your ability to handle, do not hesitate to contact your supervisor for assistance. At the barest minimum, give your patient relative some hearing aids. And it's also important to be respectful to your family members and you allow for privacy during visits. So that will mean that you would politely excuse yourself if your presence is not needed during that visit. And if you do observe, because sometimes families can also be tricky and chaotic, if you observe that your patient begins to have behavioral changes or problem after the family visits or are involved, while you cannot interfere in the family dynamics, it's important to also reach out to your supervisor. While families can be quite beneficial, they could also be quite a source of stressors for some people. So, and keeping that in mind, you want to also know that it's not everybody who have a good relationship with their family members. By and large, you need to be able to navigate the many complexities that will trail family systems, especially in the elderly people you care for. So thank you for staying with me for this lecture, and I wish you a wonderful day.